how did you come to join EURenOmics?
I joined EURenOmics because I was a partner of a previous European consortium. And when EURenOmics was constituted, I was approached by Franz Schäfer, who wanted to include a work package on rare immune-mediated diseases. So since we, with other partners, had founded a membranous nephropathy consortium devoted to these immune-mediated disorders, so all the partners joined EURenOmics at the same time.
What is the innovation of EURenOmics?
Well, the innovation potential is really great because the object of EURenOmics is to provide new tools for the patients to improve diagnosis, prognosis, and new therapeutic tool as well. And to do so, EURenOmics Consortium has brought together a number of experts in different fields. And this is quite unique in Europe. What also is unique is the participation of a North American partner, which makes EURenOmics even more international. What is important in EURenOmics is that the progress, the advances that are made by the consortium can be translated into clinical terms for people all over the world. I think the achievements have been also quite considerable. People with so many expertise that there is synergism. And thanks to this different expertise, different investigators, the participation of SMEs, we collectively have reached goals that would have been impossible to reach without this consortium organization. And this is a major achievement of such a consortium, to put the good people, quoted unquoted, together and to provide all the facilities for collaboration.
What is your role in EURenOmics?
Our work package is devoted to a rare disease which is caused by antibodies called membranous nephropathy. It is responsible for loss of protein in the urine with a decrease of albumin in the blood, and it can evolve to end-stage renal failure. And this is very important to understand the pathophysiology of the disease. Great progress has been achieved with the identification of the major antigen, and all the research of our work package is devoted to understanding better the mechanisms whereby the immune deposits form in the glomerulus. What are the triggering events, and how we can treat the disease more efficiently.
What are the advances that have been made in research on membranous nephropathy?
And these major achievements include the identification of the immunodominant epitope in PIRA2R, that is the antigen which is associated and may be responsible for membranous nephropathy. Other achievements include the development and the establishment of a biobank and a registry of membranous nephropathy with more than 400 patients that have been included in the database and have been biobanked. And also we have just completed the first randomized controlled trial using anti-PIRA2R antibodies as a marker in patients treated with rituximab or with rhinoprotective treatment. Now, these are three major advances that have occurred in the diagnosis and monitoring of membranous nephropathy, allowing a better understanding of the pathophysiology, like the identification of the immunodominant epitope.
What is the vision of EURenOmics?
The vision of EURenOmics is really to provide patients with new diagnostic and prognostic tool and new drugs. And I think this is really important because we are doing research for patients. And that's the reason why I'm so happy with my partners of the work package 3 to be part of EURenOmics, because within EURenOmics we can accelerate our research program in order to identify these biomarkers that are necessary for the monitoring of patients.
What would you like to happen before the EURenOmics project ends?
I think we have achieved a lot, as I said, but we are only 2/3 of the way, or 70% of the way. So we would like to understand better the genetics of membranous nephropathy in order to decipher the triggering events that lead to the development of this disease. We would like to expand the biobank a lot and to include other associated partners, such as in Budapest or in Barcelona, to make it more European. But I'm not anxious about the achievements. The most important is sustainability. I would like to have evidence of sustainability coming from Europe or wherever, so that all we have done and achieved, and especially the registry and the biobank, could be continued and expanded.